I'm Kathy Butz. I'm a psychologist and the clinical coordinator for pediatric psychology. My initial experiences in psychology in general were with an abuse population, and what I felt was that a lot of these kids didn't really have a voice. They didn't really have people supporting or advocating for them. And so I think the advocacy piece was really the root of why I chose this profession and wanted to come into psychology in general. The way I got into pediatric psychology was by an initial experience with cancer patients and really seeing and appreciating the resilience that a lot of these patients have given all the treatments and potential diagnoses and outcomes that they might be facing. I think that's our main goal, is to challenge patients to find their inner strength to overcome whatever they are dealing with. And I think in that work, there's so many opportunities to learn from them. So as I'm wanting them to make breakthroughs and recognizing their own power and resilience, I'm also striving to work harder myself. To recognize the impact I have on others makes me want to do more. And so from a general standpoint, that's how I'm impacted every day. I love my job, and it's because of the kids that I work with. And I have a recent patient who I've met with who have a very rare rheumatologic diagnosis. And not only is there not a lot of knowledge and support out there in terms of the treatments about this, but it also was having a significant impact on her, both physiologically, emotionally, and physically. So meaning she was experiencing a lot of pain, but also experiencing some deformities in her bone structure of her face predominantly, which was having a major impact on her emotionally. When you're able to talk to folks and be successful in sort of changing that view, that perspective that they have in that moment of diagnosis, back onto all those things they knew about themselves prior to that diagnosis, pulling from the things they know they're good at, the strengths that they do have, and getting them back in touch with that, that's what's really rewarding and revealing to them as well. A lot of these kids don't see it that way initially. They only see it as the diagnosis and all the bad things that may come with that. And when you're able to get them re-linked in to all the things that they did before the diagnosis and get them re-involved, that's what can be really rewarding, not only for the family certainly, but for myself. So being able to, again, have them identify the areas that they're already resilient in, that they probably were already resilient in, and making them aware of how they can put that into play, even given this lifelong diagnosis, is really great. Well, it's a child-friendly oriented place, and so I think kids are comfortable walking in the doors, which is very, very important, because when given a medical diagnosis and maybe having an unknown prognosis, and also being told, we'd like you to go see a psychologist, which some families don't really want to do. If they're coming to a welcoming place, that at least helps get them through the door with a sense of comfort that they're in a good spot. They're going to hopefully get what they've been looking for. And so I think the environment here really helps to produce that sense of warmth and comfort and support for families. And I think that the faculty that we have and how many areas that we're involved in also provides this notion that come to us, because we can pretty much help you with anything. Sometimes we're very challenged with diagnoses that we may not know much about, but I think that there's a willingness on pretty much everybody's part to help out however we can. We have this funny saying that they're no worse off if they didn't come see us than if they did come see us. So we're doing some good just by recognizing that we're available to them and that we're a resource. I think just awareness alone is what's really important. I think that event, which I've known about for several years, is only becoming more prominent in our community. Our community in Columbus is such a wonderful community, lots of grassroots, mentality of we can do this, let's all come together. And I feel like that black tie ball event is an example of that. How we see it here is just more resources and more avenues to explore where we can impact not only the Columbus population, but also far-reaching. And I really think that that's a goal for most people in Nationwide, is to go well beyond our doors and impact as many people in Ohio and certainly other surrounding states that we can. And I believe that the funds that come out of that help us to do that better. Their heart is in the right place, and the mission of their work is good. We're impacting a lot of people. There's a lot of kids these days that need help, and we're able to better do that with their backing and support.